Hi, Marcy, can you hear me?
Hi, I can. Can you hear me okay?
Good. Yeah, you can hear you. Yeah, go ahead. You got about 10 minutes total.
Okay. Okay. Well, first of all, thank you so much for letting me be a part of this process. It's important to me for a number of reasons. I would like to share my screen with you as I start my presentation and tell you how I came to be here. Oh, I'm sorry. Okay. So, sorry, I'm just trying to get this started here. So I just wanted to let you know how I came to be here. A few years ago, I had no idea of much of the effects of wireless radiation. And I'd heard there was a little bit of problems with cell phones, and I always was a little bit careful, but I didn't really think much of it. And then I was a teacher. I worked at a school, and I heard that they were going to put up a cell tower across the street, and there might be some possible adverse effects. So after hearing this, I decided to do some investigation. I was a teacher there, I was a student there, and I was concerned. The more I learned, the more concerned I became. I saw so much research, peer-reviewed research. I was very alarmed. I heard that there was testimony in the House of Commons to the Standing Committee of Health that girls' eggs were being radiated, which could affect future generations. I learned that Wi-Fi was a class 2B carcinogen in the same category as lead and DDT. Surely this must be a mistake, or at least as somebody who cares about my students, I didn't feel comfortable using the Wi-Fi. So I unplugged the Wi-Fi. Previous to doing this, students had come to me saying, "Oh, Mrs. Kliparchuk, why are we sick all the time?" And we kind of laughed it off because they were sick all the time. I could only send them to the office so many times. And then eventually I would just say, "You know what, put your head down, get a drink of water, see how you feel." They experienced dizziness, nausea. One student who had a horrible earaches all year, so bad that he had to go home, he never had another one. I never told my students that I unplugged the Wi-Fi. I personally noticed some tachycardia, things with my heart. I would be sometimes carrying my son who came to see me at lunch, and my arms would feel like I didn't have control of them. I knew that there was something going on, and that is how I would like to start my presentation. I'm going to copy something into the chat room, and I'm going to ask you to please pull it up on your screens, and I'd ask you to watch a short video. Can you hear me? Hello? I can't hear you.
Can you hear me now?
Yeah, I can hear you. Were you able to hear me while I was talking before?
Yeah, we can hear you. I was just asking if it's going to come up on our big screen. Is it?
Oh, I was told that I need to copy it into the chat room, and then you need to open it up. So everybody needs to go into the chat room and copy the URL and then open it up on your own screen. Yeah, I didn't get any details for how to give any of my information. I was never provided this, so they said this was the only way that I could provide my video, and I'm hoping this won't cut into my 10 minutes because it's very precious time. Okay, so has everyone seen the video? Or please let me know when you can, or when you're finished. Yes, can this be put up on the big screen? It was really intended to be shown on the big screen. I assumed you guys had that capability there, and it's kind of an important video. Do you need the link again, or? Okay, somehow my microphone got muted. Can you hear me now? Hello? Can you hear me now? Oh dear. Can you nod that you can hear me at least?
I can hear you.
Okay, thank you, because I couldn't, okay, I'm going to keep going. I'm sorry, we had quite a few delay there. I'm going to keep going. Okay.
Can you hear me?
Yes, I can. Thank you. Okay, I'm going to move very quickly now. So dispelling 3 common myths. Health Canada's guidelines are very protective. I'm sure you've heard lots of testimony today that the guidelines are only based on a heating effect only, which was based on a model of a 220-pound, 6-foot-tall man. And there was some definite errors in or some oversights in that I wanted to talk about. A serious error was reported in Canada's Safety Code 6, and it was reported in the examination of the potential health impacts of radio frequency electromagnetic radiation. A big part of a problem with Safety Code 6 was humans were not included as conductors in a circuit. A model of a large man was used. So not only were humans not included in the circuit, it didn't include the fact that children absorb 10 times as much radiation into their bone marrow, twice as much into the skulls, multiple sources of radiation were not considered, and I asked if there was any research on kids that had braces or any kind of metal pins or things like that, and I received no response. I was concerned because my daughter had some she had some metal appliances in her mouth, and that really concerned me. Myth number 2, scientific research does not demonstrate health risks from low level of wireless exposure. Actually, this is false. There are over 5,000 scientific papers that demonstrate harm. There's 1,800 new scientific peer-reviewed studies, thousands of times below Health Canada's guidelines in the 2012 Bioinitiative report. It calls for microwave radiation to be classified as a human carcinogen, and actually when it was classified as a Class 2B carcinogen, I believe there was only one country, which was the United States, that really pushed for that, and there was 29 countries that were pushing for it to be an actual definite carcinogen. And I heard there was lots of problems with study as well, such as not following the participants for long enough, excluding people that should have been included, and a number of other problems. What does the science say? Peer-reviewed, replicated, and published science shows many different risks that we cannot sit by and watch while our children are exposed to this. DNA damage, irreversible infertility. This is not acceptable to expose our children to, especially without the consent of parents. I was never told as a that my child was being exposed to microwave radiation. I do not consent. My school boards told me I don't have a choice. They are providing the safest environment possible because Health Canada says that it's okay. That is unacceptable. Some new studies that are showing that the levels of electromagnetic radiation in the sleeping area are linked to autism. Here you see a graph that shows the increase in microwave exposure and the increase in autism spectrum disorders. They measured the level in the mother's bedroom and in the children's sleeping area, and they were very surprised what they found so far. This is a very important slide, and I'm going to come back to this one. Myth number 3, Wi-Fi levels are the same everywhere. Actually, they're not. In schools, we use generally an industrial strength microwave radiation, and it's similar to standing about 100 meters outside of a cell tower all day long. I was shocked to learn that the dangers of wireless frequencies are now accepted medical education offered as CE credits in over 50 states across North America. This program is offered to over 200,000 health professionals. If we are learning that these frequencies are dangerous, it's an emergency that they are not being used in our schools. The Auditor General has reported that poor information sharing is a problem within our government, and it seems to be that's exactly what's happening right now. So as back to the examination of electromagnetic radiation, I was saying there was testimony shared in the House of Commons that girls' eggs were being damaged, possibly irreparably affecting all the future generations. There was a study in Toronto by Marcey who said that when they studied mice exposed to levels of electromagnetic radiation less than we have today, they became infertile after 5 generations. What does that mean for people today? Where are we going? The NDP complementary report urged that children should not be forced to be exposed to a technology until it is proven safe. And I agree. They also pointed out in the report that there's effect on the bee colonies, and we need the bees as pollinators. This is something we cannot stand by and ignore. Really noticed with the the recommendations from the Standing Committee of Health is that these recommendations are not being followed out. This is a general overview. It said Health Canada and Industry Canada were supposed to have a comprehensive risk awareness program. As a teacher, I had no idea what symptoms to look for, and I didn't know as a parent. I had no idea, and basically if they were related to Wi-Fi and I go to the doctor, my students go to the doctor, they might be being misdiagnosed, and I'm sure that's already happening. They were supposed to promote the safe use of technologies. They were supposed to have a process to receive and respond to reports of adverse effects. I went to the health minister about this. I've written letter after letter to anybody I could, my school board, the provincial health minister, the federal health minister, everybody. Nobody, I was not told till quite some time later that there was a system in place to report adverse effects. Once I did report adverse effects, I was told, oh, well, there are no adverse effects because we're following Safety Code 6, and so that doesn't exist. I emailed back, I said, well, aren't you going to go check the levels in the school and make sure that they're okay? Aren't you going to ask me any questions, which students there are, and do any investigation? There was no follow-up ever. They were also supposed to examine EHS and policies on radiation in other countries. They have not done that either. The report also asked for that the error in Safety Code 6 be investigated. As you can see here, Canada allows a lot of radiation compared to other countries, although they share information with the schools that they're some of the most protected. Here's a report showing damage to birds and bees and wildlife, which cannot be ignored. Other effects or other concerns, cumulative effects were not considered. Government looks at averages, not peak levels. Those are biologically important. For example, if plants are exposed to a frost, they die once a certain temperature is reached on a given day, regardless what the average temperature is that day. As I said, once I heard about these possible effects, I unplugged the Wi-Fi in my school. My students got a lot better. My own daughter suffered terrible migraines once Wi-Fi was installed. I pulled her out of school. Here's a teacher pulling her child out of school and homeschooling her. All of a sudden, her migraines all but went away. She's doing better. My son, at one point, he ended up having a seizure, and the doctor said, well, he doesn't have a fever. That's very strange. He's not sick. And I thought, what was different? What could be different? And then I saw out on his train table, he had the Wii controller. Are they related? I don't know, but we really need to look into it. Where do other teachers' unions stand? Three teachers' unions representing 300,000 teachers are taking action on this. At what point is our health agencies going to come in and help out in this issue? Parent groups, fortunately, are taking action, creating safe schools initiatives. Warnings on these devices are not being followed. You can see the BlackBerry warning here. It says, keep it away from your body. We're not being told this. We're not teaching our kids this. It says, keep it away from the abdomen of pregnant women and the lower abdomen of teachers. There's actually research showing damage to DNA 2 meters from a phone. And many organizations are saying to keep at least a meter away from people while you're using a phone. There's also research showing damage from texting.
Marcey, I'm sorry to interrupt, but could you wrap it up, please? Because we've got a lot of other people waiting to say something. So you'll have to.
Yes, I can. Yes. Okay. I just have 1 or 2 quick slides. Here are some examples showing cell towers. This increased risk. This is important because there are many cell towers being placed by schools. It's unacceptable. Here's a cancer cluster, all children in room 131, 131, 131. There were several cancer clusters in the school right across from a cell tower. I heard no one is enforcing the levels. This tower exceeded safety guidelines. It still exceeds safety guidelines, and no one is doing that. There's a new study out of Brazil that shows almost 5,000 cancer deaths from cellular antenna radiation. It was a study over 10 years. They found 80% of the cancer deaths occurred around 500 meters of a cell tower. Actually, yeah, 500 meters of 300 cell towers. So why is this important? Sorry, 1 minute, just my most important point. This is the same level of radiation exposing our children to with the Wi-Fi in schools. These deaths seem to be directly related to those levels. If we're exposing our children to this kind of radiation in schools, let's put 2 and 2 together here. We need action. Cancer, there's too much evidence. We need to protect our students in universities and in lower schools. Why standards need to change. Thank you very much.
Okay. I have to stop you.
Thank you for your time.
Okay.
Yes, I understand. Thank you for bearing with me as we had some technical difficulties. It went far over. Thank you very much for your consideration, and I'm looking forward to following up with more information. And
Thank you.